I'd like to thank Renato and his wife, Virginia, for allowing us to come today to talk with you. I'll be talking in English. I'm sorry I can't speak Spanish.
Portuguese?
Or Portuguese. I hope you can understand the English. Today I'd like to quickly go through some of the concepts of planning healthy and sustainable cities, and then talk about the process and give you some Australian examples, and also we might have time to look at some green examples of green buildings and green eco-villages that I've been doing some research on. So certainly, please stop me if you have a question halfway through, whatever. As you can see, we're from Brisbane, as Gia and pointed out before, and Margaret. This is the Brisbane city. This is the Gold Coast area. In fact, this is my house, just here. This is where I live. Where? Just here, this building here. And this is the Rainbow Bay area, Gold Coast. I'm homesick now, I saw that. And of course, this is the large Brisbane city of 1.2 million people. It's based on a river. It's a river city. And in about 1996, Brisbane developed a community plan, a community health plan. I was engaged as the consultant to develop a WHO World Health Organization public health plan or community plan for this city. And of course, now that plan has evolved over the 5-year period, the next 5-year period, to now a active and healthy Brisbane city. Okay, it's a corporate plan to drive the mechanisms of this big monster of a residential and industrial city. At Griffith University, we have the Urban Research Centre, the Centre for Environment and Population Health, the School of Environment where I work, and we're concerned with sustainable transport systems, managing metropolitan growth, urban ecological systems. This is a sort of the language. We're concerned with reducing urban greenhouse gas, energy security, strategic metro planning, urban studies and energy use, sustainable cities, and of course conservation and protecting urban biodiversity. So we're trying to green the cities at the same time. And so my work's been involved around the planning of sustainable and healthy or green cities. But of course we have the emerging threats of climate change and the impacts on people's health and their quality of life. And so we have to be very concerned about the emerging issues about heat stress, sea level rise, disease patterns, the epidemiology of disease like dengue fever, which is coming down from the tropical areas to the subtropical areas because of the rising temperature. So there's a whole lot of shifting disease patterns that I get involved with in my own research. Now this is the IPCC fourth report that was delivered to the UNFCCC meeting in Cancun 2 years ago, as you know. It's about the interaction of humans with the Earth systems and the need to have mitigation of emissions of CO2, industry, and also humans trying to adapt to changing climate. And in the middle here is some of the things that we need to do, like socio-economic development, technology transfer or technology ideas, governance, literacy, health, equity, population, migration, culture, and of course economic trade. And up here we've got food security, human health, and over to the left here, greenhouse gas emissions. In Australia, they've introduced a carbon tax of 27 US dollars per tonne equivalent for carbon tax. So any industry that's producing carbon is now required to pay this taxation. And the taxation goes to improving the emissions of companies, subsidies for residents who have higher electricity bills or higher water bills. The European carbon tax is only $6 per tonne. So in Australia, our carbon tax is almost 4 times more than the European model. And so the carbon tax is impacting on the quality of life of Australians, I believe, into the future. Even, for example, with a waste landfill producing methane gas, like a secure landfill producing methane gas, the local government has to pay the tax per tonne of methane that's being produced from the landfill. In one small city of 200,000 people, the projected tax is $36 million over the next 15 years. So it's quite substantial. Of course, the local government could use that, and they could invest in more clean or zero waste policies to reduce their emissions, but they don't have the infrastructure cost to do that. So the cost of carbon will be passed on to the consumer in the short term. This is an issue for, again, quality of life of poorer suburbs. We might get some subsidy, but not enough, I don't think. We have a problem with food security. Producing quality food in Australia with climate change. We have increasing intensity of droughts, maybe for 10 years, and then increasing intensity of floods or cyclones or perhaps bushfire. So it is affecting the production of food in Australia, and we have concerns about that. We have the possibility of sea level rise in certain areas of Australia. So on the coastal fringe, the sea level inundating some of these areas, the impact of cyclones and large waves, so not tsunami, but we have tsunami in Indonesia, north of Australia, and Thailand and India. And of course these people here may need to migrate or shift maybe up to the higher area up the top there, up the hill. So everybody's going up the hill, and it costs money to plan the migration of people away from coastal areas. We haven't quite started thinking about that clearly in Australia, but there are some communities that have significant erosion, and some planning is occurring called climate change adaptation plans. Every local government has had to develop a climate change plan for the next 5 years to look at the impacts on human health and biodiversity. And the communities that are significantly affected have received government funding to manage some of those environments in Australia. I'd like to talk about the global planning that's going on in Asia, and then talk about specific health planning in local government in Queensland that I'm doing. So this is the big picture. This is the end poverty by 2015, big plan for Asia. There's a lot of poverty in Asia, in Thailand, in Indonesia, in Malaysia, and all of the big agencies, UN, Millennium Campaign, World Bank, UNICEF, UNEP, you know all of these agencies, WHO, UN Habitat, FAO, all got together with communities across Asia, with governments, to develop the Millennium Development Goals, the targets for development by the millennium. And it's really a big strategic business plan for the whole of Asia. And Australia contributes to that process. So the bigger countries, the bilateral and multilateral relationships between America, Australia, England, give money to Asian countries to put in place goals and targets. It's about this thick. It's a huge document, okay? Ensure environmental sustainability is the biggest target, target 7. And target 1 of goal 7, is to integrate the principles of SD into country policies and programs. And target 2, reduce biodiversity loss. And the targets go on. And and underneath this, over to this side here, are the programs 1, 2, 3, 4, 5, 6 that sit underneath that target. And bilateral money allows the Indonesian government to carry out some sort of program around that target. So it's a strategic business plan, globally funded, specific for Asia. Now, I'm not sure whether you have Millennium Development Goals in Brazil. I don't think so. No? I don't think MDGs are currently in Brazil.
No, we have it.
You have something like that?
Yes.
Right. Okay. Next, this week today, this week in Rio, of course, the developing countries and the developed countries are reporting back on their sustainable development progress. It's very subjective because there's no measurement of sustainable development progress in terms of indicators. Most of the measurement is done on GDP or population growth or the value of the currency, but there's no specific measurement. So what's missing here is a need to measure, did they achieve this target? Excuse me. And if not, by how much wasn't it achieved? And so many of the developed countries will say, yes, we've had significant improvement in incomes and quality of life and our health statistics, environmental statistics in America, Australia, China, perhaps, Malaysia. But in Thailand, Indonesia, India, we've had significant decline in health statistics. All right, so there's an inequity between the developed countries and the developed countries. And some of the priorities across this Asia-Pacific region are to end poverty, universal education, gender equality, child health, and maternal health. In other words, the maternal health statistics, deaths of children per 100,000, it's very accountable. HIV/AIDS across Asia, environmental sustainability, the keeping of forests, the biodiversity of the marine environment, so land and sea, green and blue, green and blue, land and sea, and of course, global partnerships. None of this can happen without partnerships between all the different countries. So in Rio, the last couple of days, they've been arguing between the developed and the developing countries about who pays for this type of development. Firstly, they've all agreed we need to move to a green economy in their planning. And secondly, they're suggesting some financial mechanisms for the transfer of funds between countries to make this happen, to make this green economy happen. So they've agreed on those two things, but they haven't agreed on how much, and who's going to pay. So that'll happen this week. We'll probably see some progress this week. Now I'll move away now from the global picture and come down to city by city or town by town. So the World Health Organization has developed a healthy cities model. And that's the model that I find most attractive to do social health planning. And I've stuck with this model for about the last 10 years now. So it's a healthy city model. If you search WHO office Geneva or Manila or European office, WHO in some of the health planning in Australia under public health planning or municipal public health planning, and more recently community planning, you'll see this sort of language. A process of political commitment, so commitment from politicians, institutional change is the language, capacity building for health, partnership-based planning. That's what I'm doing. I'm actually suggesting that in Brazil, getting all the partners together, government and non-government with industry and community groups, NGO, around the table to plan the future of the city or the town, also plan the future of precincts or places within the city, certain places where people go within the city, like shopping districts or recreational districts, okay? And of course, a range of innovative projects Now, what I'm finding out in Brazil now is that you seem to be doing a lot of innovative projects. There's some good innovation, but you're not doing it in partnership with everybody. You're doing it in isolation, I think. And so the difference with the WHO model is everyone come together around the table and let's plan for the next 10 years, at least, about our quality of life and our infrastructure. Now, there's about 2,000 cities now in Europe. That's 1,200. There's 2,000, and there's about 300 cities in Asia that I'm working with. I sit on the WHO steering committee for the Alliance for Healthy Cities in Manila, and we have an office in Tokyo. And so I spend about 3 trips a year working with that WHO committee to improve the partnership-based planning. Some of the other words we're using is health advocacy, risk communication, risk management, health governance, health in all policies. In other words, every policy you develop, whether it's in mining, transport, recreation, health for health, you always have to add the health impacts or the environmental impacts. So it's no longer a situation where health's in charge of health, or environment's in charge of environment, or transport's in charge of transport. All of them impact on each other, so they need to talk to each other. What would be an ideal situation is if the Director General of each of those departments got a pay rise when they demonstrated partnerships. In other words, you got paid an increase in your salary if you had more partners, as opposed to being increased to show single initiatives. Then partnership-based planning would be quite simple, because there'd be an incentive to plan with all the other partners. At the moment, there's no incentive to plan together, and you need to build something like that into the system.
Peter, we have been talking here. Brazil doesn't have investment planning.
No.
For more than 2 years.
About 2 or 3 years, yes.
That's one point.
Yes.
I think that I have been working in a way to strengthen the communities.
Yes.
So that they look for the interest. Because if we let for either the private sector or the government, they will always neglect the weaker part.
Yes, of course.
That's the community.
I understand what you're saying. Well, in Queensland, after 20 years of planning, it's a legal requirement. It's in the legislation in the Local Government Act that every community has to have a plan, a community plan. And every community has to demonstrate community engagement or partnership planning. If you don't do that, then the higher level government won't provide funding sometimes to that level of government. So you have to demonstrate this planning. Well, that's an ideal situation in Australia. But you need to start off with a voluntary process, I imagine. I'm suggesting what Renato is saying is maybe your planning should just be for 3 years initially, not 5. You reduce the time down a bit. Usually it's 1 more year than the political cycle, so the plan lasts a bit longer than the political cycle. You can understand what I'm saying? All right, so this is some of the language of WHO. Healthy, everything's healthy. Healthy food supply, marketplace. Healthy workplace, occupational health. Healthy hospital. Healthy community. Health promoting school. And more recently, healthy and sustainable, or healthy and green, or healthy and innovative. You've got to put the words around the nature of the city that you're working with. This is the Alliance for Healthy Cities in the Asia Pacific region. And in October, in Brisbane, we're running a conference for 3 days for all of the healthy cities across Asia, and we'd like to invite Brazilian colleagues and participants to come to this event. I'll just leave this invitation here for you to have a look at. We have a website that I can demonstrate to you. This is the Alliance for Healthy Cities. I'm the Secretariat of the Australian chapter. We have about 12 cities in Australia working on the chapter at the moment, And we've got 18 cities specifically in Queensland that are, all of these cities have developed a public health plan or a community plan based on WHO thinking. And so it's partnership based, and this is Gold Coast, Brisbane, and this is up to Townsville, which is an industrial city. I'll quickly just show you that. Now there's 7 steps. Political awareness raising, setting up a structure to manage the project, doing a comprehensive community needs assessment, selecting priority issues. So if you get 300 issues, maybe bring it down to 100 and work on 30 issues each year for the next 3 years. That's how we sort of demonstrate it. Developing a comprehensive plan, getting it endorsed by government as a legal plan, and then finally implement and evaluate the plan. Implement and evaluate. So this is the 7-step model to developing a lifestyle or health plan.
If you're waiting to look at this, I apologize if I'm
No, do you want to?
the question, but if we think about the metrics of health, are we talking about stressing and disease level?
Okay. The question is, what's the definition of health? We're talking about the communicable and non-communicable diseases, okay? We're talking about infectious diseases and lifestyle disease. So the dengue and the food poisoning, we're talking about cardiovascular disease, cancer rates, diabetes rates, all right, it's both. But also we add in the environmental perspective in terms of conservation and biodiversity, and a range of quality of life issues like recreational issues, access to meaningful work, okay? The broad range of social determinants of health. Social determinants of health. So anything that determines your health can go into the plan.
Do we have a kind of integrated metric? There is a lot of talks during the Rio Summit.
Yes,
About some kind of integrated metric, like we have that metric for social, what the number that they use for cities is for social economic level, IDH, okay? IDH is a very, let's say, consolidated metric. So people is kind of requesting that we should look for a sustainable. Do you have a health integrated index?
Yes, we do. We have a range of health indicators that can be dealt with to describe the level of health of the city. There are a range of sustainable development indicators built into the planning if you want it, and also cultural and arts indicators. You know, in more recent research, obviously arts and culture improves the happiness of people in communities. Sport is another factor. And so all of these indicators are a whole of health approach, but trying to pull them out one by one and showing associations is more difficult. Yeah. So I think in total, a lot of the partnership work that I've been doing is built on this, building partnerships, building networks, problem solving, joint grant writing, information exchange, benchmarking and monitoring. And so the concept is everybody's on the platform, on the train, heading in the same direction, not heading in different directions. And if this is occurring, the city can be more successful. So what we're saying is if you do a community needs assessment, you have a multi-sectoral committee, you understand the requirements of health for the city, you have lots of partners, then you have more chance of getting investment for the health of the city than other cities who don't have those things in place. So if you have a good plan, we've demonstrated in Australia you get more money from the government and other sectors to carry out the implementation. No plan, no money. And that's a simple factor that we've proven. So cities compete with each other. One city tries to be better than the other cities, and competition between cities is very positive because it produces an energy to plan better and provide better services. I've seen the competition in Korea. There's 60 Korean cities have described themselves as healthy cities. They have a plan, engagement, and the mayors are very aggressive in terms of making their city the best city. The latest one is Changwon in South Korea. It's the healthy and knowledge-based city, and it's the Silicon Valley of Korea. And so they're trying to be the most important city in Korea over the next 10 years. Whereas in Seoul City, the mayor invested $32 billion into the redevelopment of the city centre. They actually brought the river back into the city for 9 kilometres. At the request of the people said, we used to have a river in Seoul, and now the river is a subway, industrial drain, highway. And so over a period of 2 years, believe it or not, they just cleared it all, re-diverted the river underground, back to the river, and now there's a beautiful river running through the city where people can enjoy the green space, recreational space, restaurants. Yes, and I can show you a video of that sometime. And in fact, of course, the mayor of the city got re-elected to the president of South Korea. So it was a political agenda, but good for the city, you know. And all the partners work together to make that happen. This is the conference I'm running in Brisbane here on developing healthy cities on the 24th to the 27th of October. It's afhcglobalconference.org if you want to have a look at that. And of course, Renata, you might arrange for people to come, I'm sure, through your impact, your processes. So in Australia, we only have 23 million people. We only have 23 million people, so sometimes it's more easily, the planning is more easy than when you have a large population like Brazil, because we don't have the density of urban areas that some other cities have. We've got 3 levels of government, and the Australian government has a healthy community initiative, and they give large sums of money to local government towns and cities to do health infrastructure improvement. It's part of the government program. And they've developed a program called Healthy Spaces, Healthy Places. So we identify areas in the city that could be regenerated into a healthy place for exercise or activity or children's playgrounds or restaurants, arts and culture. And this sort of space planning is going on as we speak. In Queensland then, we have 3 levels of government. This is the top level. They have a 2020 plan. So for the next 10 years, we know what we're going to be doing in terms of land use planning and targets. Strong economy, green environment, smart technology, healthy people, and fair and equitable for everyone across the community. In Australia, we have a very large social security safety network. In other words, if you don't have a job, you can get unemployment benefit, or if you're socially disadvantaged, you can get income. And so that generates some sort of fairness across the community. So the rich pay taxes to help the poor, but in comparison, the poor are still living a reasonably good lifestyle compared to the poor of other parts of Asia, perhaps. We have targets, just like the MDG global targets. At the local level, we have targets. So what I'm suggesting is, if you don't have a target-based plan in this city or this state, you could move towards developing some economic targets or green targets, like cut the carbon footprint by 1/3 with reduced car and electricity use by the year 2020. So these are significant targets which were agreed to through community consultation in all of the communities of Queensland. I attended many of these events to listen to what people had to say. And so the government listened at that stage to community comment. It wasn't top-down. This one was bottom-up for the future of Queensland. The idea of community consultation is about getting ownership. You need community ownership to move forward with government to make this happen. If the communities feel proud and own their community, they won't litter, they won't sort of throw things on the ground. They'll be more careful about the ownership of the community. If it's all top down, then people won't feel that ownership and then rebel against initiatives at a local level. And that's why you get, the graffiti on the wall, and because people feel powerless. In a democracy, you should feel empowered, not feel powerless. So planning, I feel, has empowered people at a community level to get engaged. Now, I often am asked, out of a population of, say, 30,000 people, how many people get engaged? It's usually only about 20% anyway. Not everybody wants to get engaged. Only some of the community want to be engaged in this decision making. Some people don't care less. Don't forget that. That's not my interest. That's the government's. So slowly you have to improve the take-up rate of engagement within communities. Get people interested in engaging. It's like when you vote. In Australia, voting is compulsory. Everyone votes for the government because you have to. Otherwise you'll get a fine. In America, voting is voluntary, so only 20% of people actually go and vote.
And Peter, what I understand, for me it's so important, the health concept in power.
Yes.
It creates the bottom up.
It creates a bottom up.
Because the sustainable term, for me, is top down. Because it's an elite kind of, let's say, of term.
That's right.
Nobody really understands what means sustainability.
So, sometimes if you go to a community and say, why haven't you engaged in getting involved with the quality of life of your community? And some people say, well, we've never been asked before. Okay, we've never been asked. And now you're asking, I'm happy to participate. So that's interesting.
Do you have a kind of council, local council that is talking or is solving things in name of the community, or what's the methodology you use to?
Yes, well, we have the third level of government is local government, and their job is to engage communities in local service provision, like roads and bridges and rubbish and land use and land zoning. But sometimes they don't engage as well as they could. So the public health plan enables a greater level of engagement. And the community plan, also public health plan, is required by law now. So because the engagement wasn't as good as it could be, the top government decided on mandatory community planning. And now the elected councillors have to be accountable to the community. So it's an interesting shift in power in the community. So residents of Brisbane and Queensland have more power than they previously had prior to this legislation. So it's interesting. Now remember that took 20 years to occur in Queensland. So in Brazil, if you're moving in this direction, it could take, be patient. It could take similar amounts of time. Strategic planning is complex. Okay, it's a complex area, but it's worth the effort.
Renato, os diretores, nós temos os sistemas.
I agree with you a little. I think the both are important, top down and bottom up.
Yeah, you need
because
top
you
down.
don't have bottom up. I think that for a long time it's impossible to sustain.
No, sure, we have to to add both.
Yeah. And each year you have a participative planning promoted by there is not
in Brazil we have
all year during October the region west northwest sitting with the government and define what they want to do in their
to have this
kind
of plan.
It's not a long planning.
No, but to have this kind of first thing to get some money from the government, from the federal government,
yes.
it's necessary to have for cities that have more than 20,000 people. It's necessary to have this kind of thing. Without it, you don't have money from the government.
Already in place.
Yes.
All right.
And locally, you have the same kind of
plan. So what we're suggesting is the more engagement. The
The problem is the quality.
Is the quality of the plan.
The plan.
Yeah.
This is the
I agree with you. And the more engagement, the higher the quality of the plan, of course. And what we're suggesting with the Olympics coming up and the World's Cup coming up, it's a great time with an excited community perhaps to get engaged in renewing these plans and building new creative ideas in the cities. So everyone could benefit from the rebuilding of Brazil leading up to these major events, particularly in terms of engaging in healthy and active behaviour like sporting activity. And so I think you are best placed now to start something like this, I think. That we say, is your organisation right? Is it ready? Is it right to do the planning? Yes, no. I think I'm getting a feeling you are ready. Sometimes I've gone to communities and the community's not ready. So we walk away and say, well, come back in 2 years' time. Maybe you might be ready then. So you have to be organisational readiness is an important factor in strategising about this. Okay, so the guiding principles of the planning I'm doing is collaboration, participation, equity, and social ecological health, so sustainability. This is a question we sometimes ask people when we have a public meeting. What do we need to do more of or do differently to achieve the best future for the city? So we ask the resident that question in groups, and we ask the agencies that question, and we ask the politician the same question. So what can we do differently or even better to make this city even more healthy? Because if you say we want to make this city a healthy city, the politician says, oh, hang on, we've been trying to do that for 100 years, so we've already done that. No. How can we make it more healthy than what it was? And as I said to Renata this morning, we have a happiness indicator. What makes you happy? If you're not happy, why not? And when you ask people what makes them unhappy, they say disease, pollution rates, noise, density, poor housing, poor public transport. List goes on and on and on. But then at the end they say, oh, we love living here because the people are lovely. Okay, we really enjoy the people and our culture, but everything else is terrible, you know? So people are very resilient and they adapt to situations. But if you put in place good infrastructure, as physical infrastructure, a good social infrastructure, good education, then productivity improves, people are still happy, and then we start to see GDP improve, we start to see quality of life increase, and economic, environment and community factors start to build together into a cohesive whole community. And that's exciting when you see that development over a 10-year period, for example. To show that video of this is livable Brisbane. It's a healthy and active city. We have good public transport, ferry and road systems. We've moved to a green economy, green buses and gas buses. And we have in the regional areas, we have a livable Cattery Coast whole of community plan. You can see the language here is a bit different. It says strong economic development, strong sustainable environment, social and cultural well-being and community. They want community leadership. So this idea of we want leaders to help us do this, and we have objectives, strategies rolling out through this program. One of the most important parts of this area was the natural assets. This is in a tropical rainforest here on the beach, and everyone valued their natural assets as the most important part of the city. They were so proud of this area. So the obvious thing is to preserve the natural assets to have a happy and healthy city, because that was the main feature of this city. So each city has a different theme, a different feeling about what makes them feel happy about living there. So, yeah.
Does the government invest in forming leaderships?
Yes, well,
Well, how
how does that work? In this particular city, we have the mayors, we have the local government association, and all the mayors come together and politicians once per year for a conference to do training. And some of the training was based around community leadership, around developing public health plans. So there's been comprehensive training and capacity building for politicians, so they can understand some of this theory now that now it's law. So that's been an interesting event. And of course, politicians are special people, aren't they, in terms of their approaches. So yes, you need to train politicians as well as training communities.
What you call community leadership is politicians, or
It's what I understood. It's
Yeah.
not the mayor.
Yeah, it's about, that was in reference to the mayor and politicians showing leadership with the community
Okay.
in implementing all of their concerns. Implementing all of their concerns. And we have a once the plan's in place, we have a steering committee of about 20 people, and they continue to drive the actions of the plan. Now, this city was hit by a major cyclone last year, and a lot of damage to all the housing and infrastructure, and we used the plan to rebuild the city. So we already knew what the people wanted, so we used this plan, we used the original committee to help rebuild the housing and the land use and the industry around the city after the significant cyclone event. So it can be a disaster management plan as well as a city plan.
and it seems that there is in Australia they have been using some tools for quick evaluation of community
That's right,
needs
yeah.
and expectations.
Yeah, I'll give you an example. The question here from Renata is, you can have this thing called rapid health assessment. Rapid health assessment. In other words, instead of taking 1 month to collect all the demographic detail, which is time consuming, what you do is you put on a community event, put a big tent in the city, invite everyone to come like a festival, and while they're there getting free food and free activity, you get them to fill out a survey. What are some of the issues to do with the city? What's the priority of the issues? Good, bad, ugly? And you might interview 3,000 people on one day. And it's called rapid assessment. And you can use that data to build the components of the plan quickly overnight. Yeah, that's true. That's an example. Yeah.
They have a question in the beginning, are you drunk or not?
Well, you know the story. If you want to run a good public health meeting, you've got to put on food and drink. And everyone comes. No food or drink, no meeting. Yeah.
And the degree of happiness is very high.
And the happiness is high, then you get good indicator evaluation. I'd like to show you some of the work we were doing at the Gold Coast City Council where I live. In 1998, we developed a 5-year community plan, and it's evolved now into a thing called Gold Coast Bold Future 2040. So these plans evolve over time. They get better and better and better, more ambitious. Now, this city is hosting the Commonwealth Games in 2014, isn't it? I think so. So similar to you, we have the Commonwealth Games, you have the Olympics here, but this is just the Commonwealth government states. There's 30 Commonwealth states across, led by the Queen of England, you know Queen Elizabeth? We all play sport against each other. And so this was the original community plan that I did as a consulting job up till 2000. It engaged 3,000 residents, 60 members on the steering committee. It took us a year and a half to roll this thing out. But it was the first plan the Gold Coast had ever had in terms of delivering community expectations. Prior to that, bureaucrats just made decisions about what we should do. They never asked anybody. They said, oh, that's a good idea, we'll do this. They did a reasonable job, but it never had any community support. And now we've moved on 15 years later to a bold future set of visions for the city. I'd like to demonstrate that with would you mind, sir, kicking off that DVD? Yeah. I'll just show you some of the work that's being done at the Gold Coast.
The important thing about the Bold Future Vision is that it is a shared view as to a preferred future for the Gold Coast. It's not the sole property or domain of one person or a small group of people. It is genuinely a broad-based community vision and aspiration.
So, what is the vision?
Aye.
Defined by our spectacular beaches, hinterland ranges, forest and waterways, the Gold Coast is an outstanding city which celebrates nature and connects distinct communities with the common goal of sustainability, choice and well-being for all.
The Bold Future Vision has 6 key focus areas, each of which has a headline target. These headline targets will allow us to track our progress in delivering that vision.
Together, we are creating our bold future, our blueprint for a future Gold Coast. A city leading by example. Empowering our community through information and knowledge sharing. By 2040, we are recognised as a city of inspired leaders and engaged communities.
A city loved for its green, gold and blue.
Protecting and enhancing the natural environment, open spaces, beaches and waterways. By 2040, native vegetation covers a higher proportion of our city than any other major city in Australia.
A city connecting people and places.
Expanding transport, communication and social networks that link people, homes, workplaces, schools, communities and significant places locally and globally. By 2040, our efficient transport system and advanced communications network enable the shortest average travel to work time of any major city in Australia.
A safe city where everyone belongs.
Increasing our community spirit, enriching our quality of life, and enjoying a wide variety of cultural and recreational activities. By 2040, our city has the highest proportion of residents who feel a sense of belonging to their community.
That's an important issue, the sense of belonging. Yeah.
A city with a thriving economy.
Ensuring a wide variety of employment and business opportunities with a focus on education, research and development to support aspirations and quality of life. By 2040, we are the employment destination of choice with the most diverse and rewarding local employment opportunities.
A city shaped by clever design.
Intentionally directing the city's development and providing the infrastructure to enhance our environment and lifestyles, whilst promoting sustainable living choices through coastal, urban and rural settings. By 2040, we have the most livable, healthy, active and resource-efficient major city in Australia.
The Bold Future program has been about developing a clear vision and strategy for the future. It will also involve allocating resources, be they financial resources and people, to particular projects and activities set out in our new corporate plan, and it will involve monitoring and reporting on our performance and on our progress in coming months and years. So in terms of setting our vision, in terms of allocating resources, and in managing and monitoring our performance, we believe we've got the blueprint for delivering on the Bold Future Vision.
To find out more information about the vision, visit boldfuture.com.au.
This is simply an example of the published plan for each of the cities. It's got about 100 issues. It's got 4 or 5 theme areas, and then objectives, strategies. These are the partners working together who have signed an agreement, a written agreement to work together on this strategy over maybe 6 months, 1 year, 3 years, or 5 years, short, medium, long. And this is the desired outcomes, the performance measure. Did you achieve your objective for each of these strategies? And this is like a 100-page document. And so it's simply a strategic format, strategic planning format. And in behind that document, this is the document that the community see, and in behind that document is a budget and some policy statements and maybe some program detail, okay? This is just what the community sees. In our Logan city near the university, we've got a problem with obesity, nutrition obesity. So we're running extensive nutrition programs within the Healthy City program about the need to have 5 vegetables and 3 fruits per day to reduce diabetes. So that's just another aspect. Now this is Brisbane City here. Public transport that I showed you. I'll just go through and show you a couple of things here. We have an emerging green city concept. So some cities are saying they're healthy and green. And just quickly, the concept of creating eco-cities. So one of my cities I'm working with in Indonesia, in Palembang, it's sort of now talks about being the eco-city of Sumatra. And it's where all the green manufactures are occurring, solar panels, solar hot water system, wind generation. Okay, so they're trying to make industry improvements out of the green economy. And, the concept of redesigning buildings, redesigning existing buildings in the city to be green buildings is a challenge. These are some of the older cities in the world that are actually green cities, like Honolulu, Calgary, Montreal. We already have some very good green cities. Yeah, and how do you retrofit an existing building to capture water, have solar panels? This is an architectural, technological issue here, but it's what's happening in Australia. They are green fitting buildings now and building new 6-star buildings. That's the way of the future. Energy efficiency. In Korea and China, they're putting green design, trying to get rid of the roads. Don't have the roads through the city. Have a German-style village where it's more user-friendly, people-friendly. When I was at Copacabana Beach last week, very busy road on the front there. But on Sunday, they closed the road for the people. Oh, what a difference to enjoy the place without the traffic. Significant impacts of traffic. And so green building design is very complicated. There's many issues to deal with. I don't want to go into them, but I wish you luck if you start thinking about green buildings. And of course, when you start having a green mega city, a city of more than 10 million people, becoming a green city with green zones, and it's very problematic. Korea has embarked on this task. And they're using tidal power from the tide. They've got a large difference between the low and high tide. They're using that energy to power some of the cities in the green revolution. So there's different ways. When you go out to rural Queensland, we've put in place master-designed eco-villages which are self-sufficient. I'll just show you. We put in place the eco-achievement, sustainable city stuff, water management, and we've got significant energy saving in the houses of 50%, 35% reduction in carbon emissions, 40% reduction in water use, and 70% reduction in solid waste by putting in green eco concepts into small villages. And so that's the proof. That's the proof you need to suggest to politicians that we should move towards these master planned healthy city movement to green the city at the same time. I think I've taken up enough of your time, so if there are a couple of questions, I'll be happy to discuss them with you.